Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have discussed Amla Pitta in detail regarding various samprapti which we can see in our clinical practice. Now we will move on towards the Chikitsa part of the Amla Pitta. As we have seen different aspects of the samprapti, so it is by default that treatment of the each samprapti will be altogether different from each other. So let us discuss each and every aspect of the treatment from today onwards. So let us start with the first samprapti which is mentioned in the text, that because of Annapan, specifically Agnimandya Kar Annapan, Agnimandya happens, then Amotpatti, and when this samprapti goes for a long time, then even anything taken by the patient, Agni is not able to digest and it gets fermented and symptoms of Amla Pitta will occur. I have specifically not mentioned the symptoms because all of you know the symptoms which are seen in the patient or you can read in the books. So, Agnimandya Ahar, Agnivrushti, then again Hetu Sevan goes on, intensity of Agnimandya increases, and that weakened Agni or Agni Daurbalya is not able to digest even any food which is even laghu in digestion. So it gets fermented and the samprapti happens. Naturally, the treatment will be first Hetu Parivarjan, it is bound to be, then Agni Vruddhikara Chikitsa, Amapachan Chikitsa is bound to be. Now, when you are thinking about this, always remember there is Pitta Prakop, as name itself denotes Amla Pitta. So, we have to give that medicine also, which will be Ampachak and which will be helpful for Agni, and it will be good for the Pitta Shaman also as a symptomatic treatment. So, which ras is more applicable is Tikta ras. Now, Tikta ras is Ampachak. I have discussed this Tikta ras in detail when we have learned Deepan and Pachan and difference between them. So, I will not repeat this today. But Tikta ras is a major rasa and a dravya like Sudarshan, Traiman, Guduchi, like dravya are very useful in this case. Now, Tiktaras is useful when there is Tivra Agni Dushti, and that's why when Agni is not able to digest anything, then Tiktaras, because of its Lagu Guna, helps Agni for Agni Sandukshan. But if you find that Agnimandya is there but not in so much intensity, then for Amapachan you can use the kalpa like Suchekar. In common people, Suchekar is famous as a Pittachi Matra or dose for the Pitta. But always remember, all the contents of Suchekar are of Tishna Ushna Guna, and that's why when you say that it is the medicine for Pitta dosh, always remember it is the medicine only for Sama Pitta. Because if their Pitta is Niram, then and there is no Samata at all the contents of the Suchekar, because of their Tishna and Ushna Guna, will increase this Niram Pitta. So, in practice, we use Kanduda also as Pitta Shamap and Suchekar also in the Pittaja Vyadhi. What is the difference between these two? That Suchekar is the kalpa indicated only when there is a Sama Pitta Avastha, like Amla Pitta, when there is Samata is there, like Jvara, Amaja Trishna, etc. So, Kalpa of Tishna Ushna Virya are indicated when there is Agnimandya, Amadpatti, and there is Pitta Prakop. I have seen the patients that they took by their mind, okay, I have got acidity, and that acidity is because of, just I will spoke in the last few lectures, that is early morning and there is ullas and there is gunatmak vruddhi of pitta dosh. In that case, if you use Suchekar, it is not indicated, or when there is situation like ulcer and there is Pitta Prakop, Suchekar like Kalpa are totally contraindicated. So always remember, when you say any kalpa or dravya is for vata dosh or pitta dosh or kapha dosh, you should know on which exact condition it is indicated. So in this type of samprapti, kalpa of Agnivardhak, Ampachan, and along that Langan, etc., Hetu Parivarjan, even warm water as a pathya is a very common remedy. In this case, when there is Samapitta, then always remember, sometimes if there is Samata but there is also Rullas like Lakshana, and patient is saying you that I am very there is irritation and I want some relief, in that case Vaman is also indicated for Pittaja Vyadhi like Amla Pitta. In Grantha they have mentioned about Urdhva Amla Pitta and Adhoga Amla Pitta, but they have also said that Adhoga Amla Pitta is very rarely seen, at least I have not seen it in my practice. Common is Urdhva Amla Pitta. So if the dosha are really Utkleshit, then though it is Samata, you can do Vaman, because those are in the Koshtha. In general, Langanam Pachanam is the root, but the dosh or Sama dosh is are in Amasya only, and if they are Utkleshit, you can go for Vaman depending on the condition of the patient. So first set of patient with Amla Pitta having Agnimandya, Amanirmiti, and then going fermentation of the food, Langhan, Deepan, Pachan will be the line of the treatment, along with Hitu Parivarjan and Pathya like warm water, Lagu Ahar, and uh, avoid of Vidai Andaban, etc., etc., whatever it is, or Agni Mandekar, any Ahar we are. So this is the basic line of treatment about the patients of Amla Pitta having first type of samprapti of Agnimandya, Ama, and then fermentation of the food taken. We will discuss other sampraptis and treatment in the next lecture. Thank you very much.